Good morning. I hope that everyone's having a good day so far and appreciate everyone for sitting in on this webinar. I am Hideyuki Terashima, and I am a environmental geologist with the Illinois State Water Survey, which is located at the University of Illinois. And I've been working on the wateropera.org program since 2014 and currently oversee the day-to-day which involves that we make sure that the website is functioning and that the most up-to-date information useful for operators are featured on our website. So during this presentation today, I will be introducing to you what exactly the wateropera.org program is, how it's a useful program for operators that are looking to improve their compliance and enhance public health within their community, while focusing on the topic for today, which is going to be wastewater-based epidemiology or wastewater surveillance. Before I start, I wanted to quickly go over some housekeeping stuff. So this webinar will be presented on the GoToWebinar platform. For those that aren't familiar with it, you should see a console similar to what I have shown on the slide. There is a question section where you can type and submit any questions you want to ask throughout the webinar. We'll review any questions we'll receive at the end of the webinar. So please don't hesitate. Feel free to ask any questions, even if it's something like, are you going to share the slides with us at the end of the presentation? Any question you have, just feel free to enter it through the question or the GoToWebinar question section. The webinar will also be recorded and will be uploaded to our wateropera.org YouTube channel once the webinar is over. We have not applied for credits, but we'll be more than happy to offer you a certificate of attendance or help you complete any kind of form that's required by our certification agency if you're trying to get certificates for attending this webinar. If you're interested, send us an email at info@wateropera.org after this webinar is over, requesting a certificate for this webinar, and we'll be able to get it, start getting the process moving forward for you. Additionally, we will not be able to provide any kind of certificate if you end up watching the recording of it after we have it uploaded to our YouTube channel. But again, all that information should be on our YouTube channel once everything is done. So this will be the outline for today's presentation. I'll start off by introducing to you what kind of website wateropera.org is, while outlining the types of resources or information operators can find through the tools our website offers. Again, to help them better understand more water and wastewater focused topics. I've done similar presentations in the past, but we've always focused on a specific topic and highlighted resources related to the topic. So for this presentation, like I mentioned at the start, I'll be focusing more on highlighting resources related to wastewater monitoring, wastewater surveillance, wastewater epidemiology. There's a lot of different terms for this, even public health, wastewater-based public health monitoring. Those are some terms that I've saw while researching this topic. But this has certainly become a more popular topic since the COVID-19 pandemic. So I will focus on highlighting resources aimed at utilities and communities that are interested in starting a wastewater surveillance program. So some of these might be more lab focused. There are a lot more lab focused research out there as well, but again, I'm trying to highlight more resources relevant for operators. I'll then highlight examples of publicly available resources, again, that have been developed by various organizations, and how you can find those resources or similar resources through the tools that wateropera.org offers. Then I'll finally briefly discuss some of the other features you can find on our website and finish off this webinar. So what exactly is wateropera.org? It's a website which we developed at the University of Illinois in collaboration with the Rural Community Assistance Partnership, or RCAP, with funding from the US EPA. So RCAP does a lot of technical assistance around the country. They have different regions, different offices for different regions around the country. If you're an operator and you need a lot of help, especially if you're located in a rural area, RCAP is a great organization to work with. But our website, it serves as a clearinghouse of publicly available resources to help water and wastewater operators with a focus on small systems. So we have a team of staff that scour the internet to find and collect any kind of publicly available information and resources that are useful for operators. And then we provide a means for operators to be able to access that information easier through our website. So rather than having to sift through pages of search results on Google on topics that you might be, Googling, we made a platform to search for relevant resources easier to save you time. Like the example I like to give is, if you go on Google and you try to search for a resource, and you're probably going to find bigger organizations like AWWA or WEF, which is the Water Environment Federation, at the very top. Um, a lot of those manuals and resources those organizations provide tends to cost money, but everything you can find on our website, we try to collect publicly available information so that you don't have to register or pay to access that resource that we're featuring or that we're highlighting. Additionally, if operators do have trouble finding certain information, they can always call us, email us, and we will try to help them find that specific information they're looking for. Or if it's a very technical question, we'll try to connect you with our RCAP partners to tap technical assistance providers that have a lot more experience doing helping and servicing water and wastewater systems. So how do we find these resources and what exactly do we look for? Well, we have a database of over 800 organizations, such as national organizations like EPA, AWWA, WEF, as well as individual state agencies, regional association, and even vendors that do a lot of trainings or develop useful resources for operators. So each of our staff visits their websites, and we look for any kind of information on training events, webinars, conferences, pretty much any kind of event that offers CUs for operators, we collect the information. Even if those events don't offer credits, if an event is free and useful for operators, like a lot of EPA webinars, even RCAP webinars, we will try to collect the information and try to feature it. We also look for any kind of publicly available resource, like fact sheets, reports, manuals, past conference presentations, any kind of technical resource that can be helpful for operators, especially small system operators. We try to focus and collect those. We've been searching and collecting these resources since 2009, and currently we have a database of over 15,000 documents or resources, and we catalog about 12,000, 11,000 events every year. So there's a lot of really great information on here. We do definitely recommend checking it out. But the website was actually first called smallwatersupply.org, which we started early on, but we rebranded ourselves to wateropera.org around 2016. The website was actually developed, a little bit of history, but the website was actually developed for operators of rural communities where there may not have been existing internet infrastructures for operators to be able to download large PDF files, as well as maybe they didn't even have time to search for any kind of these resources, since usually for those communities or those smaller communities, there's the one operator running the whole plan. So we wanted to help those guys out. We wanted to make it easier for them to find resources. So we developed this website so they can actually have an easier time searching for relevant information. Again, rather than having to go to Google and having to sift through maybe ads to find a certain training event or a resource that fits their search criteria. So, so after we collect the information, after we collect the event information, resource information, we display those through our calendar and library tool module, which is found on our website. So our nationwide calendar tool is meant to help operators save time from having to search through numerous training providers' websites and just find all the relevant training events on a single calendar. Similarly, we collect the most useful publicly available resource and display them on our document library. Both the calendar and the library tool does have a extensive search functionality. So again, it is easy to try to find the information that you're trying to look for. I will show screenshots of how to use those search modules later in the presentation. And for each entry that we do add to our database, we make sure to provide complete summaries with, again, the most important details for operators. So for example, documents, we'll make sure to provide a short summary of that document, as well as information on where we found it, how it's useful for operators. And for events, we make sure to give you a complete summary of the event as event information, like how many CUs are offered, what are the contact information if I want to reach out to a training provider, what exactly am I going to learn from attending this event, whether it's virtual, whether there's a location, and just a bunch of information, like costs to sign up, register, and yeah. we try to include as much information as operators need so they don't have to necessarily go out of their way to find more information on their own. And for any kind of information resource we do add, we try not to host anything ourselves. We always try to make sure to connect you to the host organization's website. In the past, we've heard from a lot of operators that found the nationwide calendar tool to be a useful tool to help find events that they never knew existed. We do have a list of organizations that don't have an online presence. So, for those regional training groups, you really need to be like in their email group to be able to find out whether they're hosting a meeting that offers, maybe even one CU. We try to, again, make sure we're capturing all of that kind of training information so that we have a high quality training calendar. We've even had various vendors reach out to us asking, can you feature our event? We're having a webinar next week. Can you have it featured on our website? A lot of times they don't seek for approval, so especially if they cost money to register. So we'll tell them, if you can get it, go to the state, your state privacy agency, get it approved for credits, then we'll be more than happy to feature it. And we've actually had several vendors go through the whole process to do it. So it's been a great working alongside with a lot of these training providers as well to help them get CU approval. Yeah. As I mentioned earlier, we do deal with a wide range of topics, and every resource we add is tagged with a specific category that gets integrated into our search engine, which is part of our one of the filters you can use to search. Here's a list of the categories or filters that we use to categorize trainings, just to give you an idea of what kind of topics you can search through on our website. I'm also a big fan of making graphics, so I really wanted to include something visual on the slide. But this chart on here shows the breakdown of the categories or topics covered from around 12,000 events that we added during 2024. It's kind of hard to tell, especially with all the text and the numbers next to it, but I just really wanted to highlight that a lot of the events we do add do focus on O&M, water, wastewater treatment, certification exam prep, and distribution systems, and just a lot more other topics. And since this presentation focus is on wastewater monitoring, I did want to point out that there are several categories available that are kind of similar or related to wastewater epidemiology. So there's monitoring, which I have highlighted on there with 7.6% of our events being monitoring related. That category can be used to search for topics related to drinking water and wastewater monitoring or sampling. There's also sanitary sewer and wastewater discharge effluent. Those two categories can be helpful, especially if you're looking for resources related to maybe sampling at that specific point or part of a wastewater treatment system. So there's different ways to use these categories, but again, I just want to highlight what they are. These are the categories we use on the training side, but the resource library also uses similar categories, again, which I highlight later. And especially for wastewater-based epidemiology, it's still I would consider it still an emerging field, and there aren't necessarily standard protocols or practices yet, which is why I did have a hard time finding a lot of training events related on this topic. But now with a lot more research going into it, I believe we're going to be seeing a lot more trainings related to this topic. Similar to training events, there aren't that many publicly available guidance-related resources or manuals that on this topic because of it being rather niche and still being researched, especially there's a lot of information for COVID right now, but for all other pathogens that you might want to monitor for, there aren't necessarily that much information out there. So, and a lot of these publicly available resources are relatively new, with majority of it being developed since 2020. There are several wastewater surveillance focus groups that I found that does develop guidance documents, but a lot of these were kind of internal, they were private, and they aren't necessarily available to the public. But we were able to find a number of public available resources, which I will highlight today. Many of these resources came from organizations like EPA, which has a long history of monitoring wastewater for compliance, especially with discharge limits and setting requirements that many utilities need to follow. EPA mostly focuses on environmental protection and water quality, but their standards for wastewater sampling and data management has been pretty important for helping wastewater systems with wastewater-based epidemiology. Water Environmental Federation, or WEF is another group which has been pretty crucial in advancing wastewater management or wastewater uh, surveillance research, as well as just wastewater management, wastewater sampling in general. Um, After COVID, they partnered with CDC to develop a network of wastewater-based epidemiology, which is a program that offers guidance and tools to partnered utilities and communities interested in wastewater surveillance. CDC, or the Center of Disease Control and Prevention, as well as WHO, which is the World Health Organization, they probably have the longest history dealing with public health surveillance using wastewater, um, especially for stuff like polio virus, which was a lot more popular back then rather than right now. But they helped with the polio monitoring efforts as well as eradication efforts that was done in the 40s. Since both agencies do have experience with early wastewater surveillance, they were pretty crucial in the early stages of COVID-19 tracking in wastewater. There were a lot of dashboards on CDC's website as well as WHO's website tracking it around the country, around the state, or around the world, around the country, and even like at the state level. They provided guidance to communities, and they did a lot of coordinating efforts for collecting and sharing data between communities. So they do have a lot of great information related to wastewater surveillance that I'll be highlighting today. Um, I'll also be highlighting resources from organizations focused on topics like wastewater sampling strategies, laboratory methods for identifying pathogens, how to specifically select what pathogens to monitor for, case studies from successful utilities that implemented or case studies from utilities that implemented successful programs, and just any other resource that can help utilities to start their own surveillance program. So why did I focus on wastewater-based epidemiology? Well, since the COVID pandemic, there's been a lot more effort going into advancing this topic, as well as improving outbreak monitoring to protect public health. So although wastewater epidemiology studies were conducted as early as the 1920s, it hasn't really taken off, and it was again considered pretty niche. Even early 2000s. But since COVID, there's been a lot more studies, there's a lot more resources developed, which kind of made us want to focus on this topic. And the Illinois State Water Survey, where I'm located, is actually one of those groups that did early wastewater surveillance studies. Our organization was actually formed. Well, we were originally formed as a state agency originally to trace the spread of waterborne diseases like typhoid that was a huge problem throughout Illinois back then. The water survey collected and tested thousands of water samples from wells contaminated with wastewater to again look for outbreaks and to better understand disease transmission, which eventually led to the construction of a lot of wastewater treatment plants around the state. We actually have a lot of these older glass plates that highlight some of the studies we did, which we've also created news articles, blog posts that I believe the University of Illinois library hosts. But there's a lot of cool early wastewater research that we used to do, which I'm kind of sad we don't do anymore. But it's cool seeing all these historical records. But polio is another public health concern that existed as early as 1900, with serious cases happening in the 40s and the 50s, or outbreaks happening in the 40s and the 50s. There's a lot of studies from the 30s that highlight attempts to isolate polio virus from wastewater, and how they did find that polio virus can be detected in wastewater during outbreaks, but not after demonstrating its ability to be a time-sensitive indicator for outbreaks. So although there were wastewater-based epidemiology studies in the past, especially pre-COVID, there was a huge shift early 2000s from monitoring waterborne pathogens to drug monitoring to see whether pharmaceuticals and drugs usage were within their, or to better understand pharmaceuticals and drug usage within their community. Antimicrobial resistance markers, which are genes of microorganisms that are becoming more resistant to antimicrobial drugs. Studies were also starting to be expanded more as wastewater treatment plants were trying to learn whether they can actually treat these pharmaceuticals or illicit drugs in their wastewater systems. But there was really few real-time applications where data was readily available to help with public health decision making. But this all changed when COVID hit. There was a surge of wastewater-based epidemiology studies, and there's thousands of studies that happen on this topic. Many of these are focused on tracking community-level trends for COVID. and using that data as an early warning system for outbreaks, which many states and organizations did eventually monitor for and implement, and using various methods like genomic sequencing to better locate and understand variants. We've also heard a lot of COVID variants like Omicron over the years, but again, this effort does help with establishing those studies and making sure that we're actually monitoring the variants that are of concern. Here's just a picture of news articles that I found over the years. Again, some of these highlight new treatment, new analysis like PCR. It also highlights how wastewater systems were able to detect variants of COVID in sewage. Um, Even more recently, there's a lot more research going into doing more studies in rural areas because doing studies in rural areas is a lot different than doing it in an urban area. Um, and even right now, like this was a news article just like from this week where a new COVID variant was found and is surging in international communities. So it's really important even now to make sure we're still doing these kind of studies and making sure we're looking for we're protecting public health by monitoring tracking these information. So again, COVID was really a catalyst. It did help accelerate the innovation of public health surveillance using wastewater, especially with high infection rates. Traditional methods like just contact tracing wasn't really efficient and couldn't keep, we could, or because of the number of cases, those methods weren't sufficient to keep track of, especially in the community, COVID in the community, especially with asymptomatic patients that weren't showing any kind of symptoms. So that's where wastewater-based epidemiology really proved its value by helping detect traces of COVID, RNA, DNA found in wastewater. Definitely helped scientists monitor for viruses, virus levels across the country, and again helping to use that information as an early warning system. And as a result, policymakers, health officials, and even the public began to recognize the power of wastewater surveillance. And there's a lot more research and guidance material now related to that topic. But how did it exactly become popular? Well, there were advancements in new analytical methods for outbreak monitoring. qPCR, or quantitative polymerase chain reaction, it's an analytical technique that really gained popularity in the early 2000s due to its ability to measure the amount of genetic material like viral RNA in real time. But even before then, PCR was primarily used in research, but it did extend into clinical diagnosis, environmental monitoring, and like food safety testing in more recent years. And during COVID, it definitely became a groundbreaking tool for wastewater surveillance. Whole genome sequencing, or SARS for COVID-19, also became widely popular. Whole genome sequencing lets of the COVID virus. Data on that was readily available, which the World Health Organization shared publicly because there was a lot more groups actually doing studies of COVID variants back then. This rapid availability of genomic data, particularly through platforms like the GIS or Global Initiative on Sharing All Influenza Data, which is a data platform to share a lot of those pathogen-related data, helped a lot of communities to focus on monitoring for specific variants of COVID. And tools like machine learning also played a critical role to help wastewater surveillance by helping researchers analyze data easier and work through with huge data sets to better analyze data. Additional factors that help incorporate wastewater surveillance during the pandemic was, increased funding and investments. A lot of state and federal governments were, interested in funding the research related to this, helping the public better understand, infection rates. Pilot programs like this definitely help to standardize sampling and testing protocols and help build out infrastructure like additional laboratories, increasing laboratory capacity to sample more or to be able to manage more samples. Alongside funding, a lot of collaboration partnerships were pretty critical. Public health agencies needed to partner with wastewater treatment plants to get samples to analyze. They needed to get funding as well, and especially they needed the support of the communities as well to make sure that they were actually had support from the community and that they can continue their wastewater monitoring projects. In the early stages of wastewater surveillance, one of the biggest challenges we heard was the lack of consistency in how samples were collected and processed. So different labs use different methods, which made it difficult to compare results, as well as across cities and states and even countries. To address this, research groups pushed for the development and adoption of standardized protocols. For wastewater treatment plant operators, this meant that there's clear, concise details for sampling, where to sample, how many samples to collect, what kind of equipment they should be using to sample. And for laboratory personnel, standard methods like best methods to concentrate virus within a sample, techniques like that, techniques like RNA extraction protocols to ensure that there's consistent data quality among their samples, and so they can interpret data correctly. A lot of standardized protocols were developed for laboratories as well. And with the launch of the national surveillance initiatives like CDC's National Wastewater Surveillance System, that also played a role to help a lot more partners, a lot more county health departments, a lot more wastewater systems to be involved in wastewater surveillance. Now, a little bit more basic information about the standard protocols for wastewater sampling. Here are several common sampling methods used in wastewater surveillance, each with its own strength and limitations, depending on monitoring goals, available resources, and there may be a specific plant design. So the first is the 24-hour composite sample. So this is considered the gold standard. This method uses a automated sampler to collect small volumes of wastewater at set intervals, usually like an hour for over a 24-hour period. There is a portable one shown on the top image of how it looks like, but these samplers can capture fluctuations in flow throughout the day because they're taking samples in regular intervals. And it does provide a more representative snapshot of a community's overall health. And it's especially useful for tracking trends and pathogen levels throughout the day. It's the most ideal method for routine surveillance, but again, the required equipment is costly, can be costly, and there is some level of maintenance involved. And a lot of these samples can range from anywhere from like a couple $100s to a couple $1,000s from what I saw online. Next is grab sampling. So this involves collecting a simple sample or a single sample at a single point or at a wastewater treatment plant at a time. So this process involves using like a container, like a bottle, to collect samples to collect samples directly from the wastewater stream. It's much faster, it's much cheaper, but it is more prone to variability since it might, if you're not taking samples regularly, if you're just taking one sample, it might not reflect the condition of the whole community throughout the day, and it can be limiting, but it's still useful, especially in settings where there are limited resources. And the second image kind of shows someone collecting a sample from a manhole. So especially if you don't want to invest too much into waste, like an auto sampler, this is a good starting point, or grab sampling is a good starting point. And the third option is passive sampling. So in this method, a device, which is shown on the bottom of the slide, and if you look at that image, you'll see like there's white cloth inside this blue sensor-like probe. That filter or cloth filter is used to track, this module, the probe itself, you'll put it into the wastewater stream and you'll leave it there for an extended period of time. And while the wastewater flows through this probe, the cloth captures any kind of pathogen or virus, which can be collected later and sampled later. So this is a very cost-effective approach. It requires less labor. It's less equipment needed, or a smaller amount of equipment needed, and it's less labor intensive, so you don't have to really worry about it. You just have to deploy it, collect it later on, and then send it off to the laboratory to test it. So, but samples should be collected at where the wastewater goes into the plant, so the wastewater influent, or these can also be deployed at a manhole or sewer access point, or where samples can be collected at those points to get a better understanding of the community's wastewater or public health, as well as maybe just a target neighborhoods or local communities public health. And once wastewaters are sampled or collected, they can be shipped off to the laboratory to be analyzed. And this slide might be a little bit more technical and geared more towards laboratories, but here are kind of the basic methods or the more preferred methods for analyzing wastewater samples that has viruses or pathogens. The most common method used is it's called RT-qPCR. I kind of mentioned what qPCR earlier, but this stands for reverse transcription quantitative polymerase chain reaction. So it basically works by turning viral RNA or DNA, or it turns the RNA into DNA, which makes it so that you can actually copy those DNAs using PCR, and then the machine, or you utilize a machine to detect the number of lights or fluorescent lights that's given off when these copies are made, to kind of identify or quantify how much viral material is in there. So if there's more light, there's more virus in the sample, and it's a pretty easy way to figure that information out. It is widely used. It's very cost effective, and it's or it's mostly accurate. But it can sometimes miss low-level signals if the virus concentration is very low. Another method I found was digital PCR or dPCR. This is similar to PCR, but it breaks the samples up into a bunch of tiny samples, and then you measure the lights given off of each sample. So this process gives a more higher precise data, and it's more sensitive, especially because you're looking at tiny sample sizes. But it does help you quantify the amount of light emitted off of each sample easier to actually quantify how many the pathogen concentration in that specific wastewater sample. In addition to quantifying the virus, we can also look at the genetic code through, whole genomic sequencing. This lets us identify, various or specific variants or strains, like, for COVID, Delta, Omicron, or any of the newer ones. Wastewater sequencing can also detect new variants before they show up in clinical testing. So it's a useful tool, or it's a very useful process to again identify which variants might be a concern or risk for a certain community. Now identifying which pathogens should be monitored for in wastewater, that's also pretty crucial. COVID was pretty big. A lot of states, a lot of communities were already sampling for COVID, but again, it does continuing to monitor for COVID. It still does help communities. It does help protect them from outbreaks early on, and again, it does help. A lot of agencies, a lot of county health departments are still tracking this information, which can be a good starting point for a lot of wastewater treatment facilities. Polio is another long-standing example. It's been monitoring for decades. I don't think not that many communities still monitor for it, but I did see some state dashboards that had polio on there. Influenza or RSV, which is respiratory-related viruses, are also common pathogens that I saw were being monitored for, especially for a lot of older communities with older or younger children or older residents. RSV can be very detrimental to their health, so it's especially useful for monitoring those. Norovirus, another virus that has been studied for a while. It does cause stomach flu outbreaks. This is another one has been detected in wastewater and is being studied. AMR or antimicrobial resistance, that's just always good to monitor for to keep track of how pathogens are becoming more resistant to antimicrobial or becoming more antimicrobial resistant. And I did include illicit drugs and pharmaceuticals on here as well, but again, there's a lot more research out there studying for environmental impact of wastewater release in there, or wastewater release into the environment that has these kind of contaminants in there. So if you're more focused, if you want to do more environmental related wastewater epidemiology, those are the kind of things that you want to be looking at. And utilities really should prioritize pathogens to monitor for within their communities. They shouldn't be doing all of these. Again, they should just figure out their outbreak risk within their community, population vulnerability, and they should coordinate with health departments, again, identify which pathogens they should be monitoring for. So the overall benefits of participating in a wastewater surveillance program, first and foremost, operators are helping their communities or their community health. The data they collect does support public health decisions, like when to issue public warnings or allocate medical resources. Being part of a program like this can also raise the value of wastewater operators in the eyes of the public and decision makers. If the community knows that you guys are doing a lot of these interesting studies, they might help. You might be able to get more public support for other projects that helps improve the community or public health. Um, so how can utilities get involved? A great starting point is to contact your local or state health department. Many of them may already have wastewater surveillance programs or are looking for utility partners. These agencies can often help you access federal funding to do sample analysis, collect samples, again, which will help reduce the burden on the utilities themselves. They might have also more technical expertise on the topic, where partners may be able to assist wastewater treatment plants for sampling or, again, to identify what pathogen to sample for. Another option is to join the CDC's National Wastewater Surveillance System, which is a national program that links health departments and wastewater treatment plants in a coordinated effort to, again, increase the number of wastewater samples collected and increasing the number of wastewater data available. They also provide technical assistance. They do also provide guidance. They have a lot of resources on their website. They also have networks of partners to help each other out. Utilities can also connect through peer learning groups like WEP's Utilities Community of Practice Collaborative, which is a collaborative that gives wastewater operators a space to share experience, troubleshoot challenges, talk to each other, and just learn best practices from other wastewater professionals in the industry that are also doing wastewater surveillance. So that was a more basic overview of wastewater epidemiology, and hopefully I kind of covered a lot of information, but maybe it was a starting point for, especially if you weren't aware of any of these these topics. Hopefully you learned a little bit about wastewater epidemiology. But now I'll transition and I'll highlight a number of public available resources that, again, provide additional details as well as help you get started on a wastewater surveillance program. So for utilities interested in getting started with wastewater surveillance, EPA has a comprehensive guide that can serve as a great starting point. It's titled a Compendium of U.S. Wastewater Surveillance to Support COVID-19 Public Health Response. So it's a 132-page guide that walks through the key building blocks for setting up and running a wastewater-based epidemiology program. This one specifically focuses on COVID-19, but it can be adapted for similar health crises. So the guide covers practical topics like, how to find funding opportunities, how to work with partners, what partners are currently out there that, does similar wastewater surveillance work, which analytical methods are, commonly used, like, PCR or genomic sequencing, which one is best for your community, and how to design a utility-specific program, which includes, like, how to develop a sampling strategy, where to collect a sample from your specific system, and how to interpret those results and translate it into something that you can use for, sharing to the public. This information, majority of the useful information for wastewater system is covered in Chapter 6 of the manual, which I have a screenshot of on the slide. But again, it focuses on how to implement that specific surveillance program. So the guide includes, real-world case studies from different states. For example, they have a number of it, but I do have two states highlighted on this slide. The one for Indiana, it mentions how the Indiana Finance Authority led a wastewater monitoring program in university towns and college towns to help identify COVID outbreaks before clinical testing before clinical testing caught up to speed. Utilities identified sampling locations within university collection systems, like influent to the wastewater treatment plant on campus, manhole or lift stations that represent specific dorms, populations, Greek housing, and they even collected samples outside of their university community, like apartment complexes, as well as long-term care facilities, to improve data coverage, as well as, again, better understand COVID rates within their community. They did release a public report on the program that highlights and summarizes the purpose of the program, highlighting, what kind of data they found, what kind of temporal trends they saw within their university community, again, which helped to increase the public health within the campus at least. And although the wastewater data was not found to serve as a leading indicator of new cases because of um, factors like sample turnaround times and again, it's a university town. It's hard to interpret fluctuations, especially when you have a lot of students going in and out of the city. But the data they collected did offer useful information to complement their public health monitoring on COVID-19. Wyoming also had a similar program, but they sampled at individual wastewater treatment facilities. They actually provided financial incentives to utilities that participated by um, paying $300 per sample and providing them bonuses to communities where they provided consistent sampling. Wyoming also purchased composite samplers for the communities and reimbursed up to, I believe, $4,000 for each sampler that the communities purchased on their own. Um, Wyoming also provided technical assistance to communities throughout the Wyoming Association of Rural Water Systems, which helped them collect data and which was eventually used to develop their public dashboard, which shares results from each wastewater treatment plant. And I also noticed that using incentives like that, helping wastewater treatment plants, giving them financial incentives to collect sample is really a great motivator to actually get those samples to you. But overall, this guide is specifically useful for operators and utility managers because, again, it breaks down the technical information of what they need to start a program into actionable steps and to better understand what partners are needed to involve and how to get public support. The World Health Organization also has a similar comprehensive guide, which helps to bring together communities, health professionals, laboratory, utilities, and any other partners involved that needs to be involved for a good wastewater surveillance program, and how to work together to develop a good program. So the intent of this is that wastewater surveillance should be integrated with other data sets to understand the community public health better. So this guide really mentions, how you should integrate hospital data like case reports to wastewater data to interpret the data better. If you see a rise in number of cases and you see a rise in reported cases and a rise of number of pathogens within a wastewater sample, again, that can help tie data better. And data sharing between partners is especially crucial to make sure that up-to-date data is being provided to these health agencies making those decisions. The guide also highlights the key components of a good program. This includes, selecting what pathogens to test for, how to prioritize which pathogens to test for if you have multiple pathogens on your mind to test, and other public health significance and technical feasibility information, like whether your system is capable of sampling or whether your system is capable of sampling these, or whether your laboratory is equipped to sample or analyze for specific pathogens. The flowchart on this slide is detailed within the guide as a method to choose target pathogens. Site selection and sampling strategies are also highlighted with an emphasis that sites should be chosen based on whether they represent the target population. Like, whether you sample from your wastewater treatment plant influent or within a certain manhole of a specific neighborhood. The guide also includes a table on different sampling strategies, as well as equipment needed to better help wastewater utilities understand, what equipment they need for depending on what kind of sampling they want to do. Additional information on laboratory methods, as well as quality assurance and quality control steps, as well as how to normalize that data to calculate pathogen concentration per capita, and how to use that information to interpret public health is included. The CDC also has several resources I wanted to highlight today. Though these are now archived CDC pages, they are still publicly accessible and they do include a lot of useful information, so I did want to highlight them. But these are more web pages. They're smaller than some of the guides I just mentioned earlier. So if you're still new to this and you don't want to go through a comprehensive manual, but you're trying to figure out all the relevant information, these pages can help you better understand what's involved in a good wastewater surveillance program. So the first web page I have highlighted is the Developing a Wastewater Surveillance Sampling Strategy page, and it outlines the steps for developing a good sampling strategy, stuff like identifying whether a community-wide assessment or a target assessment is more usable or more valuable, determining how to sample, how often sample, where to sample, just a lot of great information. It does include information like how if you really want to do a study, you do need a minimum of 3 samples to, again, identify how trends change over time. But it also includes like how to collect grab samples, just yeah, any sampling information you're looking for, this page definitely has a lot of that information. The second web page on here is the wastewater surveillance testing methods. So this is more on how to test samples once collected, but it provides a good overview as well as a laboratory workflow that which kind of highlights how these samples are processed. It includes information like what are the different testing methods, how is RNA extracted from DNA, how pathogen detection methods are done, and how to choose the best method for a specific community. It includes like graphics, which is shown on this slide as well, where it shows how the sample is prepared, how it's concentrated, uh, where at what point RNA is extracted, as well as how they're measured. And again, I mentioned earlier, the way this works is you measure the number of light emitted from these samples whenever you create copies of these virus DNA. You can see how the different smaller samples at the very bottom where RNA is measured, you see some of them have light emitted. Like though the machine is measuring those lights to, again, identify how much concentration of those viruses on there. But again, this web page will help you understand how all those laboratory processes are done. CDC also has 2 additional pages I wanted to highlight. The first is the wastewater surveillance data reporting and analytics page, which outlines the essential data elements, such as wastewater treatment plant service area characteristics, sampling time, location, laboratory testing parameters, like concentration methods, what methods were used to extract the RNA, viral recovery efficiency, just any other information required to better interpret the laboratory data. And it also provides step-by-step guidance on converting, that data to normalized viral concentration per capita data, so that you can actually utilize it for statistical analysis or to actually identify how much of that viral concentration is present within the community. Complementing this page, public health interpretation and use of wastewater surveillance data webpage also provide additional guidance on how to translate those normalized data and how to use them to confirm the presence of pathogens within the sewer shed, how to track short and long-term data trends, as well relative to sampling frequency, and how to apply those findings to support targeted site surveillance efforts. It also highlights the benefits of a wastewater surveillance program, how to communicate those benefits, as well as those wastewater trends to the public, and again, integrating that wastewater data into a data portal like a COVID-19 data portal. So together, these 4 resources from CDC does provide a comprehensive blueprint for launching a surveillance program. Here are additional resources to better understand what kind of pathogens wastewater surveillance have been used to study for, as well as national trends in wastewater surveillance. So the first resource is from WEF, and it's a 1-page fact sheet titled "Wastewater Surveillance Isn't Just About COVID." So this is meant to be more informative than technical, and emphasizes emphasizes what wastewater surveillance can monitor for and should monitor for other than COVID-19. So it includes a list of pathogens found in untreated wastewater in the U.S., such as monkeypox, polio, norovirus, and 7 other pathogens that have, again, common pathogens that have been detected in U.S. wastewater. Each pathogen is provided with common symptoms where exposed, why they are concerned. Many of these are already part of a state or local program and is being surveilled or being monitored for. But a lot of these have also been added to CDC's core panel list, which means that public health laboratories and utilities around the country agree to monitor for that specific pathogen, utilizing standardized sampling procedures and test methods. So especially if you're trying to find data, these are the pathogens you should be able to find readily available data for. The second resource I have listed here is a 33-page report from the Association of Public Health Laboratories, or APHL, which presents the findings from a national survey, which was done early in 2023 to benchmark U.S. wastewater surveillance capacity and what else is needed to enhance or to promote that kind of effort. So the results show that, um, well, the results first, they were provided from at least 127 state and local health districts. So it was a pretty comprehensive survey. And it showed that 41% of those labs were at the time performing or planning to perform some level of wastewater testing, with most tracking COVID trends at the time. And many of them mentioned that they were planning on moving on to non-COVID targets as well. So the report details the laboratory analysis method utilized, what kind of sampling collection methods were used, how often samples were collected by these health departments, what methods they were used to analyze the data or samples, as well as how they analyze the data themselves. But the main part I found interesting was that this table containing pathogen targets, and which I have shown on the slide. It's on the right side of the slide. That table shows the list of pathogen targets, as well as the number of health departments that were already testing for it. So again, stuff like this, it can give you an idea of what labs are prioritizing, which may help you prioritize what pathogen to monitor for your community. So let's say you decide on a list of pathogens you want to monitor for, and you want to find more information about them, especially related to wastewater surveillance. WEF has a set of 7 fact sheets, which are intended to be used as guides when these pathogens are detected in untreated wastewater, and um, how to safe, as well as information like operator safety, what kind of PPE they should wear whenever they're taking these samples to protect themselves from these pathogens that might be still active in wastewater streams. They have one for AMR, they have one for Candida auris, they have one for influenza, monkeypox, polio, respiratory virus, as well as COVID. The screenshot I have shown on this slide is the fact sheet for influenza. It is 20 pages long. It's pretty comprehensive, but it starts off by highlighting, what kind of role wastewater surveillance plays, and what wastewater workers should know about the specific pathogen, in this case, influenza. Like for influenza, positive hits of the virus has been detected in feces, but there weren't necessarily positive hits within the wastewater stream itself. So, but again, operators should still be following safety protocols whenever they're taking these samples. And this fact sheet, or this fact sheet kind of outlines all the information operators need to be aware about. Um, and the fact sheet itself, they also include additional information like, where should they should be sampling this for, how frequent they should be sampling for, and additional information like how finding influenza pathogens in wastewater can lead to identifying flu trends within a community, as well as how it can be used to identify specific flu outbreaks, whether it be seasonal or whether it be something bigger like another COVID-related like pandemic. So each fact sheet contains the same level of information for each pathogen, and it should be reviewed by operators, especially if you're planning on wastewater surveillance for the 7 listed pathogens. Similar to WEF, the World Health Organization also has a series of 6 reports that provides information on wastewater and environmental surveillance for several pathogens. They have one for cholera, again, influenza, monkeypox, polio, typhoid, and COVID. So these reports are around 20 pages each in length. Again, a little bit more comprehensive. These fact sheet, the screenshot shown on the slide is the cover page of the influenza report, but the report outlines, how wastewater surveillance of pathogens like influenza is a promising component to traditional flu monitoring, as well as identifying seasonal and to pandemic level outbreaks. It also helps to better understand the key characteristics of each pathogen and provides information, on whether monitoring for these pathogens will provide actionable results for a community or not. It's less wastewater operator focused, but again, it does help you better understand why it's important to monitor for these, and the significant impacts a community can get from monitoring for these pathogens. Now, if you're curious what kind of programs are available in your state, WEF, or what kind of wastewater surveillance programs are already existing in your state, WEF has an interactive map called Wastewater Surveillance Program Websites and Contacts by Jurisdiction map or webpage, which can be used to search for in-state or nearby wastewater surveillance programs, as well as the contact information for each program. Uh, Using this map, I was able to find that for Illinois, the Illinois Department of Public Health runs a infectious disease surveillance program, which focuses on monitoring and reporting community level transmission for COVID, influenza, and RSV for each season. They also partnered with the University of Illinois to develop the Illinois Wastewater Surveillance System, which is an online portal that provides real-time data from 81 monitoring points around the state. So for those from Illinois, it's a really cool map. You should definitely check it out, and you can find a lot of great information on IDPH's website or IDPH's wastewater surveillance website. Other states also have great programs or similar programs that may offer technical resources. New Jersey Department of Environmental Protection has a 5-page guide, or it's more like a checklist titled Guidance for Wastewater Utilities Engaging in Wastewater Collection and Analysis for COVID-19 or SARS-CoV-2, which can be used by utilities to ensure that they're collecting the baseline minimum data required for public health decision making. So the checklist really can guide utilities through, whether they're following the correct sample site selection process, how to select and calibrate sampling equipment, whether they have the required number of personnel and laboratory capacity to test for for COVID, as well as how to interpret that data, or whether they're following the right procedures to interpret that data and identify trends. So the guide really helps guarantee that sampling is consistent, that quality control measures are in place, and that resulting data representative of the system that's doing the sampling. So visiting these state-specific programs can offer additional information as well as access to state-specific guides that might be useful for state-specific utilities. Now, in case there are some health department or lab personnel in the audience, I did also want to highlight WEF's Utility Engagement Toolkit for health department and labs, which is a web page which walks users through how to develop a strong partnership with local wastewater utilities and how to start a wastewater surveillance program with them. It walks users through the essentials of building those partnerships, from understanding the day-to-day roles of a wastewater operator, what a wastewater professional's priorities are. Maybe they don't care too much about wastewater surveillance, but if you're helping with the monitoring efforts, they might be more inclined to implement programs like this. And in stuff like how to reach out to an operator, maybe like going to operator focused events like conferences, training events to actually reach out to operators, as well as reaching out to individual utilities, how to call them, how to email them, what language they should be using to again get utilities to be involved. It also includes success stories, case studies with that highlighting programs that were successfully implemented to again highlight the benefits of joining a program. There's also a comprehensive section on options for offering support to operators in return for providing samples. It's a great list. It includes information like providing supplies and equipment for sampling. I believe up until this year, WEF used to still provide auto samplers for communities. I think they aren't accepting any more requests, but looking for, again, checking your state, checking your more regional organizations to see whether there's support like this, which can be shared to utilities, can also help them, get more involved with wastewater surveillance related programs. So if you're a health department, you're trying to get a utility involved, this is a great area to look for any kind of tools, material that can be shared with operators to get them involved. One of the strategies also mentioned was sharing success stories. So WEF has a sewer stories webpage, which features a number of videos showcasing wastewater utilities that are assisting in public health monitoring through wastewater surveillance. Each video is about 5 to 6 minutes long. They're not that long, but it features a wastewater system personnel from each state or from various states. And the one I have highlighted on this slide features the Clark County Wastewater Reclamation District in Las Vegas, Nevada, where their general manager recounts how they got approached by researchers early during the COVID-19 pandemic area for Las Vegas to participate in wastewater surveillance. Even though they were unfamiliar with the concept, they saw that it was a good tool to help enhance public health, especially since this is a very tourist heavy area or community. So it was really important to see the potential of wastewater monitoring to identify community health, especially including visitors, seeing how fluctuation change, and again, to monitor for outbreaks, especially since it's a tourist-heavy area. WEF also compiled a YouTube playlist, which includes a list of case studies from news agencies highlighting how wastewater public health monitoring has been positive or has provided positive impact to public health, which again can be shared with your community as well as the wastewater utility to again, show, hey, this is how wastewater surveillance is useful. We want to do a similar program. Let's partner up and do something similar. And for wastewater utilities that are interested in starting a surveillance program, I do highly recommend checking out WEF's Utility Community of Practices page, which serves as a centralized hub for resources for those involved or interested in wastewater surveillance. It's a collaborative initiative for wastewater utilities to share wastewater surveillance best practices, lessons learned, and just help accelerate the implementation of public health monitoring using wastewater around the country. The group does focus on understanding best practices for sample collection logistics, best practices to communicate with health departments and partners, as well as how to promote the value of wastewater surveillance to utility leaders, as well as decision makers. So by joining a collaborative or program like this, wastewater utilities will have access to monthly virtual meetings featuring informative presentations, case studies, as well as opportunities to share ideas and best practices with partner utilities. Utilities will also have access to a member-only SharePoint site, which includes, again, private materials that aren't public accessible. I really wish I could check these out, but I'm sure they have a lot of great information there as well. They also do have a forum where utilities can connect with each other to partner, to share ideas, as well as just to have a conversation going. Utilities can request to join using a sign-up form, which is available on this page. And if requirements for participation are met, they will receive access to member benefits. And as far as I'm aware, there aren't any costs associated with joining these, but it's definitely good to reach out to rep and ask any question you might have if you're interested in joining a collaborative like this. I also wanted to mention the National Association of County and City Health Officials, which is a membership-based organization that represents close to 3,300 local health departments around the country. And the organization focuses on advocating for resources and policies that strengthen public health. They also support communities that are wanting to implement wastewater surveillance through their Fostering Local Wastewater Monitoring Network program. This program allows local health departments interested in wastewater monitoring, regardless of their experience, to request technical assistance, share resources, and collaborate on projects. You do not need to be a member of NACHO to join this network. It's open to everyone, and there is a survey that you can fill out to request to join. They also have a wastewater surveillance resource library, which includes a lot of great information on wastewater surveillance, guidance documents, other resources from federal agencies, case studies, again, highlighting how wastewater monitoring is a useful tool. They also have a webpage titled Lessons Learned from Wastewater Surveillance Mentorship Program. So the organization does offer a mentorship program where they connect local health departments' experience in utilizing wastewater surveillance with local health departments that have no experience, that are new to this, and that mentorship program help the health departments that have no experience to again get a better idea of what they need to do, gain guidance on how to start a program, as well as any other additional information that can be beneficial for those county health or those health departments. Right now, I don't think they're accepting new applicants. They just completed the mentorship or accepting applications for mentorship for the year 2025, but I'm sure they'll open it up again. And this might be another program, especially if you're a health department that are new, you might want to look into this whenever their mentorship programs open up. But again, you can always join their Fostering Local Wastewater Monitoring Network, and you could find that information on their page, and you should be able to find the survey to request to join. I also wanted to highlight 2 webinars from EPA that covers their experience with COVID wastewater surveillance. I'm a type of person that likes watching videos and reading, so if there's an option for a webinar, I usually tend to go for those. But both of these webinars, they're around an hour long. They were presented during 2020, but they cover a lot of material relevant for wastewater utilities, so I kind of wanted to briefly highlight them. The first is the SARS-CoV-2 and wastewater monitoring webinar, which was part of the agency's free water research webinar series, and which is a monthly webinar series the EPA hosts. This one specifically highlights the agency's COVID wastewater monitoring efforts, and it kind of highlights, what kind of sampling they did, which are the more robust sampling methods, Q and QC protocols for sampling, as well as how what kind of equipment they should be using, whether wastewater utilities should use like a 24-hour composite sampler, best practices for sample preservation, how to get that sample to the laboratory, common laboratory methods for identifying viral load, concentration, and just a lot of great information to understand how wastewater utilities would be involved within wastewater surveillance. The detection of SARS-CoV-2 in wastewater to inform public health webinar. It's very similar to the above webinar, since this one was also presented in 2020, but this was part of the EP's free tools and resource webinar series. So this is another webinar series. I don't think it's monthly. I think it's more bi-monthly, but it's another free webinar series that has a lot of great information for operators. But this webinar also highlights best practices to ensure that the highest quality data is being collected and utilized to identify public health trends. But this one specifically highlights Ohio's efforts to develop a statewide wastewater monitoring program. I also checked their state program. They have a pretty impressive data portal. They also have an interactive map which shows individual facilities that were sampled, as well as information on COVID trends from each facility. But either of these webinars are worth checking out to learn, again, more about wastewater surveillance, again, in a video format. And the last resource I want to highlight is WEF's free self-paced online course called Wastewater Surveillance 101. This is a free course, free for members and non-members. It provides a foundational overview of how to use wastewater as a epidemiologic tool, starting with basic information on public health monitoring, partners involved. Wastewater operators can also learn the basics of public health wastewater monitoring and the role of treatment plants through this class. It covers factors, like how to sample, how to select sample sites, how to understand viral signals, how often they should be sampling, as well as laboratory workflows, how to interpret data once they receive it, and again, how to utilize it for to identify public health trends. So it's a pretty comprehensive class, and it also does offer 2 credits for completing the class. But again, there aren't that many self-paced classes like these out there on this topic. So definitely check this out if you're if you're new to this and trying to learn more about it, or if you're just trying to get credits. This is a great training opportunity for operators. So those are the resources I want to cover today. I'm sure, since this topic is new, there's a lot more research papers being developed, a lot more materials being developed. But we'll continue to look for those. We'll continue to make sure we're cataloging those information. But very quickly, I'm just going to go over how to utilize our website and how you can utilize our tools to search for wastewater surveillance related resources on our website. So again, our website URL is wateropera.org, and this is how the front page of the website looks like. There's no login or sign-in required. You can just get on the website and start using all of our resources. It's free. You don't have to register or anything. Just get on there and start using our tools. So I'll start off by showing a demo of the resource library or the documents library tool. So to access that page, you'll want to look at the resource library menu at the top. If you hover your cursor over that menu option, you will get a submenu pop up as shown on this slide. Within that submenu, you will see a document search or search for document option. You want to go ahead and click on that text to access the resource library tool page. And you can click on either of those texts, but whenever you click on them, you will be sent to this page. And this is the document search for documents page. Once you get on here, you should see this gray search module, which has 3 components to it that users can interact with. The first is the drop-down option, which says select, which is located on the left side. This is where you can select the main filters used to populate the module with search results. So there's also a keyword filter text box on the right side, which you can use to search for terms that aren't covered within the given filters. And then there is also the retrieve documents button, which once the filters are populated and pressed, it will, or once you have your filters set and you press retrieve documents, it will populate your results. I'll also note that there is a video tutorial kind of going through how to utilize our tools if you want a more real-time demo, but it's located at the very top of the page where it says watch our video tutorial. So if you click on the select dropdown option, you'll see these 4 individual filters that are available to choose from. Once you select a specific filter out of these 4, you will see a new list which will give you additional options, the sub filters to choose from. So the first filter is category, which are the 30 plus water and wastewater related categories, which I showed on the pie chart earlier. Once you select the category as a filter, you'll see a new dropdown, which will show the 30 plus categories where you'll be able to choose a specific category. The second filter is type, which can be used to search for specific types of resource. So maybe you want a shorter fact sheet, or maybe you want to look for a guidance-related manual, or maybe you're looking for a shorter video on a specific topic. This is where you can select what kind of resource type you're looking for. The third is the state filter. So if you want to search for resource more catered to a specific state operator, such as case studies from specific states, or resources that follow state regulations, you can utilize this filter. And the last one is host, which can be used to identify a host organization. Maybe you're trying to look for resources directly from EPA. You'll be able to choose EPA as a host, which will just give you all of the EPA resources on our library. Once you select one of those 4 filters, you'll also have an option to add 2 additional filters to refine your search more. But I will note that you can only use one filter type once. So you can search using category, state, and host, but you won't be able to search using multiple categories. This is where you'll have to use a keyword text box to add additional keywords. So since this presentation focused on wastewater surveillance, let's try to search for resources related to that topic. We can simply type the term wastewater surveillance into the keyword filter, but since we kind of want to demo the filters, here is an example where we're searching for wastewater surveillance using the monitoring category. So to be able to do that, you want to go ahead and select category under the select dropdown. And as you can see in this screenshot, once the category dropdown option is selected, a new list has appeared under it, where if you scroll through, you'll be able to find the term monitoring. And if you click on that monitoring category, you can then click on, you'll know that you've selected it because it's highlighted. Then you can click on retrieve documents to populate your results. So in this example, we have close to 2,400 search results, which is kind of expected since monitoring is a very broad topic. So this is way too many search results to go through. I will mention that each search result gives you, or each the page currently shows 10 search results. So you have to switch through different pages if there's more than 10 search results listed on here. And obviously this one is way too many to go through, so we'll have to utilize additional filters to refine our search. So now that we see that we have an option to use a second drop-down filter, we can choose a new filter to add. So let's say in this example, we wanted to find wastewater surveillance or monitoring related documents from WEF, Water Environment Federation. So in that case, we can go ahead and select and activate the second drop-down menu, which in this now you'll see that there's only 3 options to choose from. There's no longer a category. You can only choose type, state, or host. Since we're looking for documents from WEF, we can choose host as the filter, which will then let us choose WEF from that list. So here's an example of that. At the very top, you can see how I chose a host and WEF was selected. And when retrieve documents was pressed again, the search results refined to just 16, which is much more manageable than going through 2,400 search results. And just to give you an idea of like how you can figure out which document you might want to look for, each of these search results is provided with a title with an embedded link to the resource itself. There's also a short summary, which kind of gives you an idea of what the resource is about, how it's useful for operators, and it also mentions like how big the resource itself is. So for this one, it mentions that it's a 12-page fact sheet. We also include a link to the repository, which is the page we found that resource located. So this is just again, if you found this document to be useful, you might want to find similar resources. You can click on the repository page where you'll most likely find additional information related to that resource. So once you decide that that is a resource you want to check out, you can click on the link, which will then open up a new pop-up with the resource shown. So we do try to use the host link and not try to host anything ourselves. Again, we're trying to link you to resources available on the internet. We're not trying to take credit ourselves. But I wanted to mention that because if you do notice any dead links, that does happen. If you do reach out to us, let us know which document you found a dead link for so that we can get it fixed. But if you run into that issue and you really want to find that resource itself, another good option is to check the repository link because that might still be working. And maybe they changed the link to the resource by a tiny amount, but the page itself is still existent. Then you could check out the repository page to look for that resource. Or if you really want it to, you can also Google the title of the resource to see if there's another organization that might have hosted it themselves, or if there's a working link available through Google. And just to demo how you can use the keyword search function, you can reset the search by clicking on or pressing the reset all option listed under the keyword filter, which will, again, let you start as a clean slate. And in this case, we can just enter wastewater surveillance within the keyword filter. And if we search just that term, we see that there's close to 40 documents related to it. We do, again, expect this number to grow as there's a lot more information out there. We also weren't really looking for wastewater epidemiology resources in the past, since again there weren't really standardized protocols for it. But with more resources being developed, we'll make sure that this library continues to grow. I also mentioned that we do have a nationwide events calendar tool where operators can use to search for various training opportunities. Very quickly, I'll give you a demo on how to do that because a lot of operators, they need trainings to maintain their license. This is a great tool to find for trainings they might not know have existed. So to access that page, they can click on the event calendar menu option at the top. And once you do, you'll be taken to this page. You'll see a similar gray search module as to the documents library, but with an empty calendar. There's two options to interact with this search module. There's the select drop-down menu, which again, similar to the one we saw in the resource library, and there's also a keyword filter. The difference is that for the difference of this to the resource library is as long as you choose one of the filters, it will automatically populate the calendar. So if I click on the select dropdown, you'll again see the 4 different filters to choose from. Category, again, are the 30 plus wastewater and water related categories. Type, in this case, this will be the event types. So maybe you're looking for webinars, maybe you're looking for conferences, or maybe you're looking for like an in-person training. This will really be able to choose what kind of event type you're looking for. State will be the state where the event takes place in, or the state where credits are approved in. And sponsor is the organization that's hosting the event. So for this example, since we're in Illinois, let's see what events are currently available for or approved for Illinois operators. So in that case, you can choose the state filter, which will then give you a list of the states to select from. And once you select Illinois from the state, you will see the calendar will automatically populate with events. Since I have it set to just Illinois, we do see a decent amount of events showing. Some event names have a full name. Some of them are just acronyms of the organization themselves. We just have it set to this, so if there's more than 2 events per day, it just shortens the name to reduce the number of cluttering. But if you hover your cursor over the organization's acronym, you will also see the full event name. There is also now a clear filter option at the very top right, as well as a view list option. So the view list option is a useful tool to know. It does open up a new window, but it shows all the events in the list view. So if you're not a fan of having to sift through different month view, the list view is the way to go. And when you click on it, this is how it looks like. So if you start scrolling through the list view or the calendar view, you can try to find an event that fits, maybe something related to wastewater surveillance, but unfortunately at the time I wasn't able to find anything. So in this case, example, I have ERTC's Wastewater Short School featured. So ERTC is it's a training school for operators. It's based out of the Southern Illinois University, and they provide a lot of comprehensive training and certification programs for our in-state drinking water and wastewater operators. But they have their own testing lab, testing facility, training facility. They have a huge comprehensive facility, which is super awesome. And I've talked to a lot of operators, and a lot of them do mention that they actually went to that school to get trained. But they do a lot of training as well for our in-state operators. And let's say you're interested in this training that's located in Peoria, Illinois. Well, if you click on the event name, either in the list view or the calendar view, it will open up this or it'll maintain that pop-up, and it'll give you additional information about the event. So the start date, location, event information, the link to or the link to the event where you can register for. Under the for more info link, we try to list any links that lead you to like an agenda to again better help operators understand what happens during that specific training event. In the details section, we'll include any information like what topics are covered, whether there's like a exhibit hall, are there member costs, non-member costs, and just any additional information that will help operators decide whether that event is something that they would actually want to attend. We also include contact information, as well as how many CUs are offered, which states CUs are approved. Now let's say we just wanted to search for wastewater surveillance focus events. The best way to do this is to use the keyword text filter similar to the resource library. And in this specific screenshot, I had the example. I do have wastewater surveillance as a keyword entered. And when you search for it, there's just one event that shows up. And it's a event that's actually coming up soon, June 3rd. It is WEF's 2025 Wastewater Disease Surveillance Summit. Which is one of their, I believe, annual events where they bring together operators from around the country to discuss certain topics. In this case, wastewater surveillance. So maybe if you're, it might be too late to register for it now, but if you had seen this in the calendar in the past, this might be a conference that you might have considered going to learn a little bit more. But that concludes the demo for the calendar resource library tool. If you do have any trouble finding certain information, like a certain resource or finding, like a training or webinar on wastewater surveillance, reach out to us. We will try to help you find the information for free. It's part of our public service to help operators out there. And to finish this presentation off, I just briefly wanted to go over some of our additional resources we offer. We do have a blog page where we highlight, information like recent news, or we focus on a single topic relevant for water and wastewater operators and showcase resources related to that topic, which can also be found in through our library tool. Even for blogs, we do have certain categories to filter our blog posts to a specific topic. But on the right side, I do have one of our many COVID-focused blog posts that we developed during that period, but it does highlight wastewater surveillance as well as any information related to COVID and how wastewater utilities can work together with organizations like CDC to get like monitoring programs going. We also have 3 newsletters that we send out monthly or biweekly electronically through this program. The first is our most popular Standard Water Operator biweekly newsletter, which highlights recent news like funding opportunities, upcoming free events, as well as any new resources that we add to our library. We also have Innovations for Small Systems newsletter, which is our monthly newsletter where we highlight recent news on innovations in water and wastewater related management. This is where we do highlight a lot more research focused stuff. So you might be able to find past wastewater surveillance related stuff on there as well, but I might start including a lot more wastewater surveillance related research into that newsletter as well. And our third and final newsletter is our tribal newsletter, which is geared more for our tribal operators in their tribal communities. All 3 newsletters do cover drinking water and wastewater related topics, but if you're interested, you can get to our newsletter page through our front page of our website, and you can also sign up through that page as well as find our archive, which is under that See Recent Issues of our newsletters. I also wanted to touch on our self-paced classes that we offer. So we aren't training providers. We do these webinars once in a while, but because but we don't usually seek credits because we're not trying to compete with training providers. These self-paced classes are the few that does offer credits for some states. So our groundwater and well care class, this is our most popular class. I know it's more drinking water focused, but it's free, it's online, it's self-paced, and it does help operators better understand how to maintain and take care of their groundwater wells. This is the only training that it has been pre-approved for training hours in multiple states, including Illinois. We also have 2 additional self-paced trainings, which we developed for Mass DEP in collaboration with University of Massachusetts Amherst on cybersecurity and source water protection. These are also free. We do have a more basic general cybersecurity focused self-paced class as well that anyone can take without more Massachusetts focused information. We actually developed this because we got a lot of state agencies reached out to us saying like how they found the Massachusetts training to be useful. They wanted a more specific one for their state, which is why we created this more general one. So if you're trying to learn about cybersecurity or source water protection, these are great or maintaining a groundwater well. These are great self-paced trainings that you can access, and they're all free. So that concludes my presentation for today. If you have a chance to use wateropera.org and run into any questions, please feel free to reach out to my supervisor, Steve Wilson, or myself. Our emails and phone numbers are shown here, but you can also find our info@wateropera.org email address on our front page as well, if you scroll to the bottom of the web page. Or if you want a copy of this presentation, I know I covered a lot of different resources and links. Feel free to reach out to me. I'll be more than happy to send you a copy of this presentation. Or if you have additional questions, feel free to reach out to me as well. So that concludes my presentation. I'll move on to the Q&A section. Jennifer, do we have any questions at the moment?
We do not have any current questions. We do have a comment. Thanks for all the good information from Eric. We could give it a few more moments to see if anybody does have any questions.
Yeah, sounds good. And if you do have any questions later on, again, don't hesitate. Feel free to reach out to us. We're trying to help operators access information that they might not have existed. So, if you aren't aware of certain resources for certain topics, we'll help you find that information. And again, even if it's something technical, we're not operators ourselves, but our RCAP partners are operators with a lot of experience, and even they should have some information about wastewater surveillance, wastewater monitoring, and they do a lot of technical assistance around the country, so they should also be able to help you get started on a program like that, or help you guide in the right direction.
All right, we do have a couple questions about rewatching the webinar or catching the recording. So we'll be posted to our wateroperator.org YouTube channel, as well as emailed out in our wateroperator.org newsletter. In terms of availability on our website, the next generation of our website will have a better opportunity to view past webinar recordings, but it should also be in a blog post there.
Awesome, thanks, Jennifer. Well, again, if you have any other questions, feel free to reach out to me. We'll go ahead and conclude the presentation for today. But again, thank you for everyone for your time, and we'll be continuing to do similar webinars like this. So stay tuned about our next webinar topic, and which will most likely be next month. Thank you everyone for your time, and hope you have a nice rest of the day.